Hello, everyone. Welcome to the next show. We are going to talk about a very sad, tragic, but important topic: sudden cardiac arrests. Rates are going up across the Western world, and statistically, 90% of them are fatal, almost 400,000 every single year in the United States. So, we're going to dive into this topic in detail. And for those of you who enjoy our discussions, please check in the link down below for our separate channel where we have more discussions and share with you more insights on very important health topics. So let's go right to this topic then. Peter, do you want to talk a little bit more about sudden cardiac arrests and what everybody needs to know?
Of course, this is a very, very personal topic to me as a cardiologist. And I've had patients who have gone through this. It's never easy. You might have met someone that, they're fine until they're not. All right. And I think some people may not know what cardiac arrest is. It's really not a heart attack. It's not what I say a plumbing problem with the arteries around the heart. It's really electrical storm of the heart, where the heart goes into a fatal heart rhythm from a number of causes, which we'll touch back later, which essentially causes cessation of the heartbeat and sudden cardiac arrest, which leads to sudden cardiac death if not adequately and rapidly treated.
Absolutely, yes. And this could really happen anywhere. I mean, probably everybody out there has a story to tell. Somebody just literally will go down with a cardiac arrest.
Oh, absolutely. I think, the problem is the warning can be very mild and it can be a little bit mixed. I'll tell you one story. We had a guy come into the hospital who really the only symptoms they were having was a sore throat when they walked, which is such a strange thing. But, we said, why don't we bring them in and check a few things? And we checked to make sure they were okay. And it turned out they had really bad heart disease. And this was a symptom. They were about to have a serious cardiac event. So, I think recognition that something's wrong, knowing your body, listening to your body, it's very important because this is an absolutely lethal condition if not recognized early.
And that's so true, Ben. I mean, I think we often think about sudden cardiac death or cardiac arrest happening with athletes on a football field or in some type of athletic field. But actually, it happens at home and it happens in parking lots. It can happen.
Very true.
Yeah. 60% of sudden cardiac death happens at home.
Wow.
All right. And that's a problem because only 10% of out-of-hospital cardiac arrests survive.
Absolutely.
And the time to save these people can be as little as 3 minutes. And that's when I started just like how, and I think that's why we wanted to talk about this, right? Because to bring awareness to this about how quick action can not only save a life, but also, save, the actual person long term. And we'll touch on that.
Exactly. And we're going to go over in a moment exactly what happens during a cardiac arrest, what you could do if you're nearby. But let's talk about in a fair percentage of people, I'd say, cardiac arrests don't just happen out of the blue. There are some warning signs often that somebody has a heart issue and they are about to potentially go into a lethal heart rhythm. Do you want to speak a little bit more about the lethal heart rhythms and the process that's leading up very much for our audience to understand if they are at risk and should take some action early?
It's true. And, the patients I've seen who've survived cardiac arrests, it's such a tragic and traumatic experience for them. But, talking to these patients is actually it's really amazing because you can gain the experience of what they felt before. And oftentimes it can be very nonspecific. I always start saying this into patients at hindsight's 2020. Patients can look back and be like, oh, I should have done this. But I think just the awareness of, in the symptoms. So the ultimate final common pathway is, I think what you're alluding to, Sunil, is that there is something that throws off the electricity of the heart. Because right now, your normal heart, you're in what we call a normal sinus rhythm. So all the heartbeats are coming from the top chamber of the heart. They're conducted down to electrical cords, to electrical wiring, as I call it. And something throws it off and it causes the bottom chamber to squeeze and essentially fibrillate. And that is not compatible with life. And it degenerates into asystole, which is basically your heart stopping.
Yeah. And somebody will just literally collapse, won't they, once they go into this abnormal rhythm?
It's an unfortunate, that's the unfortunate case of it, is that these people are fine. It's not a lot of times that they're saying an hour beforehand that, they're in distress, it could just happen. I think probably, you out there probably have known someone or heard about someone that this happened to, like they were just, at dinner and someone collapsed, or they're on their back porch. And it's really just, it's heartbreaking. And it's not only very traumatic for the patient if they survive, but also traumatic for the people around, especially loved ones.
Exactly. And would you say many of these people have some warning signs, or even a certain percentage of them have some warning signs that something is wrong?
Yeah, this is a really interesting topic, and there's been a lot of like research into this. It's just like, how can we do to prevent this? And I think, that's what we'd like to drive home here today is just, we know this happens. A lot of people and the patients that I've talked to, and I had this one gentleman that had been doing extremely well and actually was very, very in shape, and just felt off. I know that's very non-specific to say, but I think people are really in tune with their body. And so I do believe that regular, like, routine care and not denying symptoms, shortness of breath, obviously, the act of, like, when you exert yourself, if you feel winded, drop in exercise tolerance is a really big thing that I drive home to my patients, especially in people who are pretty active. Chest heaviness, chest pain, jaw pain, heartburn, especially if you're not a heartburn person and it's exertional, not related to food, fainting and dizzy, unexplained fatigue. I mean, and this is a problem with sudden cardiac death. It's pretty vague and pretty wide, the range of symptoms, I should say.
Absolutely.
Yeah.
And would you say that symptoms can present differently in women versus men?
Absolutely. And we know that women are underdiagnosed with heart disease just across the board. I mean, a lot of the studies that were done on interventions, meaning treating heart disease, stress testing, were never really tested on women. It was thought of more of a disease of males, of men. As someone who still covers the emergency room, I think that if I had two people that was being called about from the emergency room, a male and a female with the exact symptoms, I'd be getting called about the male first. We always inherently this way.
People think.
Yeah, actually, women have atypical presentations. It can be jaw pain. Jaw pain is a big risk factor, or a big red flag for me, especially if it's exertional, unexplained, and heartburn. These atypical symptoms, and I think, often it can be chalked up to anxiety or stress, which can be really unfortunate.
It can be more like a heartburn rather than the chest pain if they have a true blockage in the artery, which is going to lead to a lethal rhythm.
So true.
So let's talk a little bit about CPR, which I know you have some thoughts on as well, Ben. So somebody collapses in public, which is unfortunately, especially with statistics now, not an infrequent occurrence. It's happening more and more with a lethal heart rhythm. Talk about the importance of early CPR, some resuscitation efforts in improving survival.
Well, it's absolutely vital. So the problem is that doctors are going to see you in the office before an event, in your primary care doctor's office. They're going to see you when you've been brought to the hospital. When you're going to encounter somebody that needs to perform CPR, it's probably in public, right? So it's probably at the grocery store, it's probably at your house. So it is very important for everyone, as many people as possibly can, to know how to perform CPR. The American Red Cross offers a site where you can go to and learn how to perform CPR. It is absolutely vital because what's happened is the heart has stopped pumping. So blood and oxygen are no longer going to your brain. That is, as Peter has said, not compatible with life. And if it goes on too long, you cannot come back from that. And you do not have a lot of time. You have minutes before that needs to continue the blood pumping to the brain before it's too late. So knowing how to perform CPR, learning it so and everyone else knows, is absolutely vital. So you can save your partner, you can save someone you've seen in the street, and it's an absolutely vital act to know how to perform. And it's not particularly hard. It's not incredibly hard to learn how to do.
That's so true. And I think that we think that CPR can only be done by healthcare professionals. But actually, if you look at these cases of sudden cardiac arrest in the field, or what we say out of the hospital, it's not first responders doing the initial, CPR. And it's just what's amazing to see is, I had just one gentleman who was in his car and he had been in total great health, and his car just rolled right onto a neighbor's lawn. All right. And if he was there and, if no one else was there, he would not be here today. But a neighbor had been trained on CPR and he just jumped over the fence, pulled a gentleman out of the car and did not only CPR, but effective CPR. He had done it and learned it. And not only that gentleman survived, but the rapid response is he didn't have any long-term sequela like the, what we call anoxic brain injury. And that's really the underperfusion, because if you think about it, if your heart is in puppy, it's not perfusing organs. So, we say time is myocardium, time is heart muscle, but it's also like brain muscle too.
Yep. Yeah. And I cannot overstate that point as well. As someone who's taken care of lots of hospitalized patients, the amount of times that I have seen somebody do well who's had early CPR, usually I will see them as a hospital doctor. They'd come out of the ICU because they were in the ICU first. And then I'm looking over their story and I'm seeing, yes, they collapsed and somebody was there who administered CPR. So that would involve pumping on the chest, knowing what to do. And I would urge you, if you learn nothing else from this particular show that we're doing, if you don't already, learn some basic CPR, even watch a 10-minute video, just know what to do in terms of checking whether somebody's conscious, whether they've got a pulse, and then starting chest compressions early. Literally saves so many people. If you can do that quickly before the ambulance arrives, it can make all the difference.
It's absolutely everything. And one thing I would say that I forgot to say is, before you even consider CPR, call 911. That is the first thing you do. If you see someone go down, the first move you make is you call 911, you tell them what's happening, and then you go right to the person, start trying to help them. If you can have someone else call 911 so you can get to this person faster, that's great. But that is the first thing, because the clock's ticking and you need that ambulance there as fast as physically possible.
Yeah. And trust me, that clock ticks very fast. Right? And as I said earlier, 3 minutes, but when you're the person witnessing the event, time is actually kind of irrelevant at that point, and everything you may feel like is happening around you, you just don't even notice. And absolutely, but I can't stress enough on how early intervention from just ordinary symptoms. We know that this happens everywhere, and it doesn't select. We know statistically that the highest incidence of sudden cardiac death for men is above the age of 45 and to 75. And for women, because of hormonal differences, 55 to 75 is the highest instance of sudden cardiac death. So we can statistically identify a group, but still, you just don't know.
Okay, everyone, I'm going to interrupt this fantastic discussion for a moment to tell you about our amazing expanding natural supplement store, my uniquely formulated natural supplements. We have immune support, bone support, memory support, heart support, and sleep support. Links down below. High quality supplements. We're very proud to be made in the USA, and we work with a veteran-owned company. I'm also very excited. Keep an eye out for this. Our upcoming organic chai tea mix, based on the tea that I've been consuming for many years, a health and well-being tea. ohiwellness.com if you're in the USA, North America. ohiwellness.co if you're in the UK, Europe. Check the links down below. Okay, back to the discussion. It's just so tragic, and all of us have a story to tell. I'm sure you do as well, watching something that happened in your life where you suddenly get a phone call or something happened and somebody, it might be somebody close, might be somebody who you just know, who just suddenly had a heart attack and died. And it's just the worst thing. And what we want to do here is just tell you, well, that would be a cardiac arrest. Remember, cardiac arrest and heart attack are technically two different things, but just that early CPR can make all the difference. And then typically somebody would get resuscitated if they are, I would say, in the lucky percentage to survive, go to the ICU, come out. And then it becomes a question of, why did you have the heart attack and how do we prevent it again? And that's what we would like to talk about next. In terms of prevention, I mean, we've beaten the drum many times about how you can stay healthy, how you can make sure that you are in the best possible shape at whatever age you're at, reverse any insulin resistance, stay active, eat a good wholesome diet, avoid the sugars and processed foods. All of these things will help lower your risk of developing heart disease. Would you say, Peter, that heart disease related to insulin resistance is one of the top risk factors for cardiac arrest?
Absolutely. We know that people with diabetes or glucose intolerance and resistance have a 5 to 10-fold risk of just heart disease in general. But just going back to what you said about just being healthy. And I think a lot of the topics we always, really strive and to make it a point to reinforce is being healthy, because not only people who are healthy statistically have a lower incidence of heart attack and sudden cardiac death, but recovery. All right. And recovery from that is key, because you can resuscitate someone and get their heartbeat back. But what we worry about the most is brain recovery, because if their brain isn't getting the oxygen need, and out there, if that has happened to someone that you love, I'm so sorry to hear that, because it's such a tragic thing, and I've experienced it, and withdrawing care, and a lot of these, can be preventable to a point, and I think that's a good thing that we could talk about. So
Yeah, no, I totally agree. I think once you've gotten to this point, we'd like to give you the tools to what to do in the field if that were to happen. But, obviously it is far better if we can avoid this thing from happening. So it's important to recognize early symptoms, as we talked about before. And it's absolutely vital that you do the best you can to stay as healthy as you can. And that, is again, no mystery. We've talked about it many times. It's the diet, it's the exercise, it's preventing the risk factors, but it's also good communication with a doctor that you trust. So you do want a good primary care doctor that you can bring symptoms to if something just doesn't add up. It feels weird. You're fatigued for no reason. You're having these weird symptoms that don't quite sound right. It is important to have a doctor you trust that you can bring it to and say, hey, something's wrong. And don't stop until you get an answer that makes sense. You deserve a workup. You deserve to have whatever's happening you be figured out. And if it is your heart, it absolutely is mandatory that that's figured out.
And that's so true. You can really, and you have to be your own advocate in the healthcare field and world today, because no one else will be. Really identifying your own risk factors and your family history is really important. But I think it's actually, as a cardiologist, I'd love just to go through a couple of things of what I think are things I wish patients had done before, because unfortunately, a lot of times I don't see patients until this has already happened. All right. And so identifying it early, and you'll hear a lot about, cardiac calcium score, which is a CAT scan that's done at many, bigger hospitals across the country. And this is a CAT scan that identifies plaque by giving you a calcium score. So the basis is calcium binds to plaque, and the higher the calcium score correlates with narrowing the artery. We do know that narrowed arteries can restrict blood flow to part of the muscle, which can set off this kind of electrical storm that we talked about. If you're having unexplained fatigue, shortness of breath, chest pain, again, the bread and butter of cardiology is stress testing, which looks at the plumbing around the heart, an echocardiogram, which looks at the rooms and the doors and the pumping function of the heart. We know that people who have normal heart function, which is called your ejection fraction, you'll hear that from time to time, which is the efficiency of your heart. We know that if it's normal, you have less of a chance of having a fatal heart rhythm. So the echocardiogram will look at that. And then we talk about the electrical system of the heart, or the electrical wiring, and that's really based on monitoring. You might have heard the word Holter monitoring, which really records every single heartbeat you have for a period of time. It can be 24 hours up to 2 weeks, and some people have up to a month. And that really is looking at unexplained, like fluttering, palpitations, because we do know that rapid heart rates may just be, and some people could be stress and anxiety. It doesn't always mean that something bad is happening, but it can be a sign that there could be something underlying bad going on. So it's really just not like, it's better to be proactive than reactive, I think is what I'm trying to say, is don't wait till something happens.
Absolutely, yes. And I'd like to touch upon the point of toxins, which can also affect the heart. We live in a very toxic environment. Sadly, many toxins out there, which certainly don't help. Excessive alcohol consumption would be one. There's certain drugs as well, even prescription medications, which could have adverse events associated with the heart. Injections. Hopefully you all know what I'm getting at there, especially over the last few years with certain concerns. But what you want to do is really think, if you're somebody, hopefully, fingers crossed, who's healthy, think about every single thing you put into your body, whether it's food, a drink like alcohol, drugs, injections, and just think very carefully, is this something which could potentially adversely affect my heart?
Absolutely. I think it's about being careful with your body. Anything that's pro-inflammatory, as Peter has said in the past, cardiac disease and certainly cardiac disease of the coronary arteries is an inflammatory disease. It's a pro-inflammatory disease. So anything you can do to lower that inflammation is absolutely vital. There are many medications that are pro-inflammatory. There are many foods that are pro-inflammatory. There's this high state of insulin resistance that causes a ton of inflammation. These are all going to predispose you to these kind of conditions.
It's so true. And what I tell my patients to recommend it, and there are some simple steps you can do at home. And one is just, watching out for the medications you take. And so, there are drug interactions that can prolong, certain intervals in the electricity arc that can set this off. And albeit rare, that some of these medications can be more common than you think. And sometimes they can be antibiotics. So I think if you're prescribed, medications, and again, I've always not been a proponent of like polypharmacy, but that's where we run into the cause of this drug interaction. Electrolytes. I think this is so important. I mean, I think the times I've seen people who have had these deadly or fatal heart rhythms, their potassium may be really, really low. Magnesium, I'm a big proponent of magnesium supplementation.
Good for the heart.
Yeah, and we do know that when he talked about alcohol, and alcohol can cause weakening of the heart muscle, which lowers the efficiency or ejection fraction, which can make you more prone to abnormal fatal heart rhythms. Alcohol drops magnesium levels as well, which may be linked to underlying bad rhythms of the heart. And so keep up the electrolytes, supplementation of magnesium. I love to take magnesium glycinate. I think that's a really well-absorbed form of magnesium that I take, and, staying hydrated and really just, again, going back to staying healthy, right?
Yeah, fantastic points. Yeah, this is just such a tragic topic, and we have a low survival rate. Hopefully that will improve with time. So we will finish up with closing statements. I would urge you again, if you're not already, just learn some basic CPR skills. It could make all the difference one day, and keep focusing. Fingers crossed you're somebody who hasn't had a cardiac arrest. Keep focusing on how you can naturally reduce coming back to any inflammation in your body. That will lower your risk. There are never any guarantees in life, but we want you to be the healthiest possible, as naturally as possible. And there's always things people can do naturally to lower their chances of something happening.
Yeah, absolutely. I think know your body, know when something's happening that doesn't make sense, that isn't you, and get answers for it. So when you seek help and you say, hey, this isn't me, something's happening, make sure it's not a serious condition. And, maybe it isn't. Maybe it'll be ruled out, but you deserve answers to that. Know what your medications are. Make sure they're not hurting you. So those are very important things, and stay healthy. There's good ways to prevent this.
And that's
Only you know your body best. I can't stress this enough, is be proactive and not reactive.
absolutely. And that was a great point there that you touched upon in terms of testing. If you feel like something is wrong, typically the initial heart test would be a stress test or an echocardiogram.
Stress
Right,
test.
yeah.
Yeah. I mean, stress test and echocardiogram would be the basis of a good, comprehensive initial cardiovascular examination, which can identify a lot of things.
See if there's a blockage or anything else abnormal. Yes. Okay. All right, everyone. We do hope that that was helpful to you. Once more, if you enjoy our discussions, please check the link in the description down below for our separate channel. Stay well, stay healthy, and we will speak to you again very soon.